I'd like now to ask my colleague to read out the statement from our Pennine Care junior doctor, who sends her apologies for tonight, but carries on the discussion and the concerns that Stephanie has raised about the nursing sector, and this is now concerning the mental health services for those of us who live in Tameside. So Nicola, thank you.
Public Health England statistics show that Tameside has a rate of suicide of 15.7 per 100,000 population, and notably 19.2 per 100,000 population for males, making it significantly worse for national rates. This reflects a high burden of mental illness in the area and is related to rates of depression, substance misuse, long-term unemployment and lack of life chances. Mental health services, while trying to support some of the most vulnerable members of society, have been savagely cut, and these cuts, especially to local authority budgets, continue. There is a widely acknowledged bed crisis in mental health services nationally, and demand for services has never been higher. Support services, staff numbers and waiting times have all suffered under the current government, and the future is bleak on current trajectories. Socio-economic deprivation and debt is a leading cause of mental ill health and suicide. The links with the government's austerity agenda are clear. NHS staff need time and resources to give patients the support they need in their most difficult times. While I see staff and teams pulling together and showing what a great, compassionate NHS we have, the attacks of the government on NHS workers continue. Most notably, the junior doctors in recent times, but extending to all public sector staff in terms of stagnant wages, increased demands, unrealistic expectations, and fragmentation of teams and services. I'd like to take this opportunity to say thank you for the support from my patients and colleagues through the unprecedented and distressing period of industrial action we've had. I think the government miscalculated how much support we have out there, and it was truly heartwarming to see. However, the fight continues. The mandate for private sector involvement and the evidence to suggest that private sector involvement improves health services is simply not there. The government continues its ideological attack to the detriment of vulnerable patients, children in struggling households, young people trying to make a start in life, and professionals seeking to give compassionate and safe care. I truly believe we are starting to see the increasing momentum of grassroots action against a government that seeks to look after its own, and together we will fight for the future of our society, our young people, our elderly and most vulnerable. I want a future where no one suffers mental illness without support, where suicide rates are decreasing, not increasing, and where the social and educational support that holds our society together is cherished for the lifeline it is, not obliterated by a government that knows the price of everything but cares for the value of nothing.